continuously behind me to start this oration, and I had a lot of difficulties, and then finally, with the help of our CEO Ravichandran, we finally started the oration last year, and the first oration went to John Prakash, the International Director of National Eye Institute, Washington, Bethesda, and we have the second orator whom will be coming to, and also from the same region, Baltimore, John Hopkins. And here we have my grandfather, Dr. S. Natarajapillai, who was born in 1900 and lived till 1977 and settled in Madurai. And then following him, my father became an ophthalmologist, and myself born in 57 and finally became an ophthalmologist. All three of us were trained at Government Eye Hospital, which is the second eye hospital in the world, which is in Egmore, Chennai, and I think the third is New York Eye and Ear Infirmary. And we are proud that all of us were studied in the same alma mater, and we are going to celebrate 200 years in 2019. And this is my late Dr. S. Natarajapillai, and he was born on 1st May 1900 in Palayamkottai in Tirunelveli district, and he studied in John's College, and then later he did his medical course in Tanjore Medical School and medical service at he joined in the Madras Presidency, and he started the Department of Ophthalmology in a place called Tanjore, where the Marathas ruled Tamil Nadu, the Shivaji's brother. And then in his name, thankful to the Vitreoretinal Society of India, we have instituted Dr. S. Natarajapillai Oration Award, and that's a contribution for medical knowledge dissemination by Aditya Jyoti Eye Hospital. We had 2001 Neil Kelly, and 2003 Professor Chandra from US, John Heckenlively from US, Dr. Vinod Lekkenpal from Baltimore, and Boris Cooperman from US, Frank Kosch from Germany, Klaus Eckhart from Germany, and then Jerry Shields in 2010. The next one. Okay. And this is Dr. Sundaram is here, my father, and he's an example of success comes from hard, devoted, and dedicated work. And he was born on 19 January 1927 in a southern tip of India, which is very close to Kanyakumari, a place called Kulasegarapatnam. And he retired as the head of the Government Eye Hospital in Chennai. He was the professor of ophthalmology in Madras Medical College, and during his tenure in the eye hospital, he had 9 special clinics in those days. And myself, Dr. Kumar Manikvel, his mentor, the genetic professor, and also my father did the first eye presentation on ocular genetics, which was presented at the Asia Pacific Academy of Ophthalmology in 1985 in Delhi. He has performed over 30,000 cataract surgeries in those days, and he has done more than 3 lakh patients refraction, and he is mastered the Duke Elder's refraction book, and that's the reason I thought I'm not fit to do refraction. I took up vitreoretinal surgery. And he always found mistakes in my refraction. And he has conducted several eye camps, and I'm happy to say in 1960s my grandfather did eye camps, and in 70s my father did, and I also worked in the eye camps. And there are many eye camps which is, I think, revolutionized the prevention of blindness due to cataract in India. And he also organized eye exhibition. This is a standalone exhibition in Chennai, which is there in the Tamil Nadu Science Center, where Government of Tamil Nadu has given a place, and it's called the NSS Eye Corner. And Aditya Jyoti Eye Hospital has employed an optometrist who's doing daily free eye checkup for the students who visit the Science Center. And this is the exhibition place, and that's the eye hospital which you see there, which is more than 150 years old. And these are the exhibition center in Chennai. And he has authored several books, and he has given a Tamil book to Charity. She's here from Singapore National Eye Center, and she's promised that she'll keep it in the library there. And he's got several awards. The main is the Lifetime Achievement Award of the Tamil Nadu Ophthalmic Association, and Dr. G. Venkatsamy Award. Dr. G. Venkatsamy is a legend in ophthalmology, and where even American Academy of Ophthalmology celebrated his death because his contribution to ophthalmology is a lifetime work which is done. And his mission is vision is our mission. And he always says that nobody should go blind just because people are not aware of eye care and eye diseases. And that's why I say that nobody should go blind just because they don't have money in the pocket. And that's why, on his insistence, we have started an eye care project in the slums, and we showed it to Charity, and Charity has become the chairman of the World Association of Eye Hospitals, and we are glad with their help. The entire World Association of Eye Hospital was here last week, and this whole week we have doctors from all over the world visiting Aditya Jyot, and I am happy that at this time we are doing this program. And he is presently the director of Aditya Institute of Optometry, and also the founder for the Aditya Jyot Foundation for Twinkling Little Eyes, where he has taken the place on rental. In spite of knowing all the politicians, I am not able to get a place on our own, but still we are paying rent and doing free service to Dharavi. And it's a not-for-profit body aiming to redress the suffering of low-income groups, marginalized population living in rural and urban slums and tribal areas through free eye camps and free eye treatment. And there are about 45 million blind in the world, and 1 in 4 blind in the world live in India. And that's why program like this, 50% of the low vision is due to lack of proper eye care checkup and correction. Age-related and lifestyle issues add irreversibly blindness exponentially, and that's diabetic retinopathy. And that's what our speaker is going to speak today. And these are the activities we have done in the past 6 years. And we have screened more than 100,000 people. And the various projects are on diabetic retinopathy. I'm happy the entire team is here on children refractive error, Mumbai Diabetic Retinopathy Project, free eye camps, almost 2 to 3 a week, and also eye bank facilities. And these are the various screening eye camps in Mumbai. Somebody can ask why do in an affluent city, which is the financial capital of India, but still we have the lowest income group and the highest income group, and the world's richest guy and the world's richest man having the biggest residence in the world is in Mumbai. But still, we have to serve the poor people here. So our vision for the future, to run a 5,000 square feet comprehensive eye care center with an operation theatre facility in Dharavi slum or its vicinity, and have various centers which will be a feeding center to combat blindness or prevent blindness. And so I wanted to quote a Tirukural. I'm reading this in English. The good which a father can do to his son is to prepare him for a prominent role in the assembly of the learned. And that's what he has done. And I think I wanted everybody to give a standing ovation to my father. Thank you very much. And I also want to tell another Tirukural about my mother, which Shivanandan is the best to quote that, which says that the mother's tears when whatever pain she underwent during the delivery, but when a son is achieved, and I think in the last part of her life, I had the opportunity because of my father. He said, I will bring her to Mumbai because you are working in Mumbai and you cannot come and live in Chennai where they hail from. And she was paralytic from the year 2007, and because of the second paralytic attack, stroke, she could not get up, she could not move, and she always liked to dress well, and she was a well-dressed person. And there was a poetess 2000 years back called Avayar. She said, a man is respected or a woman is respected by 50% by the look and the dress and 50% of the character. And then she had that 100% qualities. She had beautiful flowers with her all the time, which you can see on the photograph here. And she was in a wheelchair, and she was an honorary employee of the hospital. She came on rounds daily to the hospital, and I'm very proud that she went and found that made sure the hospital was clean, because I had kept her as the monitor the cleanliness of the hospital. And I'm glad, even during the 2001 survey by the Outlook magazine, we had the highest marks for the clean eye hospital in the country. And thanks to Shivanandan, who is always my strongest constructive critic I have, to continuously have improvements in the patient care. So I dedicate this award to my parents. I don't get it here. So and from even though my mother was not educated, she's from a small village. I think she gave me everything to be a good son, and I think she made sure that she's brought up a good son. So from whatever I am today is because of her, because I always brought friends almost daily and told her to cook, and she did that. And till the time, even when she passed away a year back, I think she was always happy to see, host the friends. And I should be grateful to my father and mother, because I was an introvert. Nobody can believe that. And I was a crying child. So because my father could not pass several exams when he did his master's degree, because he was tensed and he could not open his mouth. And in medical examination, we have viva. If you don't answer any question, if you don't open your mouth, you will be failed, however intelligent you are. So to make me an extrovert, he took me to All India Radio program. He made me work as a volunteer, and he also made me work as a room boy for his clinic. And I proudly worked. Sometimes patients used to give me tips, which I didn't take. And I'm happy that I didn't take any bribe those days too. And when I left him and joined Dr. Badrinath, he told me that you told me that you will start an eye hospital together, but you want to leave me. He said, even though I feel bad, he allowed me to go. And even when Dr. Badrinath wanted me to continue with him, I told him you have to take my father's permission, and then my father gave me permission to take up vitreoretinal surgery in 1984. And I think I'm glad I took up that specialty in that year. Again, thanks to my father. Next slide. And this endowment award in my parents' name recognizes individuals who have made exemplary contribution in any field of science or education that help alleviate the suffering of humankind. So the first Professor N S Sundaram and Mrs. Kamala Sundaram Endowment Award was awarded to Dr. Gyan John Prakash. And Dr. Gyan John Prakash, PhD, MBA, presently holds the distinguished position as the Associate Director of International Programs at the National Eye Institute, National Institute of Health, United States. Originally from India, Dr. Prakash has an illustrious career of working in the field of medicine, holds a PhD in medical microbiology from the University of Illinois at Urbana-Champaign, and an MBA in pharmaceutical. And this is my father and mother on the 50th marriage anniversary, which was a few years back, when they just came from Chennai, and they lived with me in this small house, and I was happy to spend the last 4 years of her life with me, and I think I at least had breakfast with her daily the days I was in Mumbai. And I'm thankful to Dr. Kumar Manikwel, who again helped me in getting John Prakash for this endowment oration, and thankful to our Minister for Home Affairs, Mr. Sushil Kumar Shinde, who gave the award oration last year. Thank you very much.
I would like to welcome Mr. D. Sivanandan, former Director General of Police, Mumbai, who's also a founding member of Aditya Jyot Eye Hospital, and I think most importantly, one of the best friends of Dr. Natarajan. the best friend, I'm sorry, not one of them. And I would like Dr. Natarajan to come back and give us an